guys, what's going on? Welcome to another video on my channel HAIRLICIOUSLY. Today we are here with the renowned Dr. Acar from Cosmedica, one of the top leading hair transplant doctors in Istanbul, Turkey. How are you, Dr. Acar?
Thank you very much. Welcome to Istanbul City.
Yeah, thank you so much. So today we are actually going to do a Q&A. I know that a lot of my viewers and subscribers have been asking a lot of questions. And now that I'm here with Dr. Acar, we are going to go ahead and ask some of the more commonly asked questions with him. So without further ado, Dr. Acar, I'm just curious, what interested you in the field of hair transplantation?
It was so, I see, after my medical education was finished, I tried to find a field where we can give something, where I can learn something, and which has an interesting future. I mean, the hair loss is still a big question on the medical field, and there is no any exact solution for that. So this was very interesting for me, and I decided to go in the hair loss field, and after then we start with hair transplantation and do some make research about medications, and now I'm here.
So let's go ahead and dive into the actual hair transplantation offered at Cosmedica.
Yeah.
Can you tell us a little bit about the DHI Sapphire method and why you feel that it is more superior to some of the traditional FUE techniques that's being currently offered?
Yeah, so first of all, like 5-6 years ago, patients asked to us anytime what size of punch we are using. The punch is for making the extraction. Right. This was a very popular question, and is of course his reason, because bigger punch leaves bigger scars, smaller punch leaves smaller scars, but we have to make the right decision for the patient. And sometimes you have to use different size of punch for the donor area for one people. But I see that no one asking about, doctor, what is your size for the recipient side? Because the size, the blade size or the needle size doesn't matter what kind of instrument you are using. It's very important to the recipient size. There are, for example, many types of blades, but they are not all the same. They have a different thickness, different length, different depth. Right. This means, and more deep means more damage on the blood circulation, and that means less success rates. And after this, I try to implement a more precise system to the recipient side in my clinic. It is so, if you use this pincet, this is the pincet that we are using for make the implantation. Right. You have to make the incisions slightly bigger.
To accommodate the forceps.
The forceps, the follicle. But if you use an implanted pen, which uses the advantage of the skin to make this in a very short time the elastication and bring it back. So it means you need just a very small, very tiny incision for that. You just open the way. Okay. Then the pen comes inside with the follicle. The follicle is protected. Right. And it makes elastication on the incision to the sides, but doesn't make a larger cut. And once you take the pen out, it closes again. So the biggest advantage is between the forceps and the implanted pen is the size of the blades which has to use it. The second advantage is here the follicle is not protected. You just hold it.
Right, and that's where a lot of damages can occur because of the pressure that might squeeze.
Pressure about during the implantation, because during the implantation it goes away about 5 millimeters, and during that you can see like the follicle can change the position, it can damage, and then again lower success rates. Right. But here you put the follicle in a space which is surrounded like 360 degrees. Yes. It means the follicle is protected during the implantation process. So two advantages. The first one is I can use really smaller size of blades. I call them miniature or micro sapphire blades or micro blades because they are a bit smaller than the traditional, which is used mostly, and protected grafts. So you get two sides advantage: faster healing, higher success rates, less damage,
Right.
and very important, so smaller the incisions are used on the front line, so more natural looking, acceptable.
Right, right. Okay. So using the technique that you just spoke about, how would you go ahead and create a natural looking hairline for somebody who wants to reconstruct their hairline? What techniques do you utilize?
First of all, again, you have to use the blade size as small as possible. If you use big blade size, it will be automatically more gaps between the transplanted hairs. This is not something natural. People saying that, doctor, I see my scalp if under the light, and I'm not happy with that. For this, you have to work more dense. Of course, everything is about the donor area, about the hair loss stage. This is another topic, but you have to use smaller size of blades, dense working, and for natural lines, you cannot make the incisions like here side by side. This is wrong. You have to make like irregularity up and down, a very natural irregularity. Then you get a good density and good coverage in the final, a very natural hairline. This is what we are doing here.
Yeah, and one of the other things that we also spoke about was using a microscope to separate each, single grafts, double grafts, triple grafts, because I know some clinics, they don't utilize microscopes. They just do the extractions and then they make the slits and they just go ahead and implant it, which also can result in some of the pluggy appearance you see.
Exactly. Another point is, after using small blades, irregularity on the front line, you have to put on the first line the single grafts.
Yes.
And the single grafts are not the same. For example, if you take the single grafts from here, on the occipital side, we have more thick hairs, mostly.
Right.
Even the single graft here and the single graft here on the temporal side is not the same. So we prefer the single grafts, what we take from here, that are different, separated again from these single grafts. So we are separate the single grafts too, inside.
Right, and it's a lot more softer on the sides.
It's more softer. This is so what we have in our nature, and so if we want to try to mimic the nature, so we have to follow the rules. We have to understand first how we have to see, we have to understand how does that happen, how can we do it with our donor hairs, where can I find the hair follicle, is it here on the central part, is it here lower on the neck side, the more softer hairs, or where it is. I had to find this with a microscope, then separate it, and we use HD microscope, and I will show you this also, we can check it together.
Yes.
And this makes the work more guaranteed.
Okay, incredible.
Yeah.
Now, speaking of hair transplants, what type of medications do you recommend for someone who is perhaps looking to get a hair transplant or even for the aftercare?
Yes, the aftercare is very important, especially because the hair transplantation comes now on very young ages, and they have their reason. Sometimes they say you cannot do a people who is 20 years old a hair transplantation.
Right.
It is true and it's not true, because it's about the hair loss stage. I get many patients, they have the 5-6 hair loss on their age 18. So there is no reason to wait. I combine them with the hair transplantation, with the soft hair transplantation, plus strong medications after. That he have a hair, I mean, he want to go to school, his social life, he looks totally different. And they told me, people asking me every day, what's happening with you? Do you have an illness?
Yeah.
Do you have a problem? So we have to help him, but of course, we have to think about the future in the other hand. So this is very important. Aftercare is very important. Aftercare, the aftercare is a part with the hair transplantation to maintain your existing hairs, to have anytime a full looking result, and that everything looks like fluent. This is very important. I recommend Finasteride, Minoxidil, I recommend vitamin tablets, PRP injections, mesotherapy injections, Regenera Activa, new regeneration stem cell system. There are many kinds of treatments, lasers, laser caps, they help also. but everything has his own rule how to use it.
Right, and they all work in different mechanisms of action.
Different mechanisms,
Yes.
exactly.
So how, as far as the regimen for finasteride, because I know finasteride is more like the gold standard.
Exactly.
So for your clinic, do you recommend someone to take finasteride? How many milligrams? Do you recommend them taking daily or
Yeah.
twice a week? What is your recommendation for?
My recommendation is first, if the patient doesn't use it before, I recommend first to start with every second day,
Okay.
1 milligram.
1 milligram.
Every second day, 1 milligram. Or if you have the option, every day, 0.5 milligram.
0.5, okay. Because that's what I'm taking.
Yes.
I'm taking 0.5 because
Exactly.
between 1 and 0.5, there were studies
Yes.
that showed almost similar levels of DHT inhibition.
Exactly. We have to try, the mentality is so, we have to try to find out at which lowest dose I can get my expectation, I can get my treatment. So if you can take it with 0.5 milligram or every second day 1 milligram, so you don't need to take it in a higher dose. If the low dose doesn't work, then you can increase the dose.
Yeah, and I think that's a good point because some people, they react differently to medication. Some people need to take it daily. Other people can get
Yes.
by taking it once every 2-3 days. What about some of the side effects? Have you seen a lot of side effects in your experience from the patients you've treated when it comes to finasteride? Because, there are some people who
Yes.
are very scared of taking finasteride. Some people just don't want to take finasteride after hair transplantation. So from your experience, what have you seen as far as the side effects?
Ira, as you know, finasteride is famous with the side effects.
Yes, yep.
The medication of the side effects. So it's very popular because if you make a research on Google, we will find out on the top the side effects of finasteride.
Right.
It is not so true. If I see in my in my patients with our aftercares that a patient take it every day, 1 milligram every day, they get more side effects.
Okay, from taking it daily.
Yes, they daily 1 milligram. They get more side effects. Then we decide to increase the dose instead of every day to every second day. But by every second day, the side effects comes very less. People get very happy, and they say they still feel the maintenance of the finasteride. It works. It stops the hair loss. It makes thickening on the crown, on the central part. So that's why our clinic's routine is take it every second day.
Okay.
If it's not work, then we will change the protocol.
Yeah, and I think a lot of people, I think it affects them psychologically because they go on
It's
Google.
possible.
Based on some of the studies that we've seen, because finasteride has been around for decades.
Of course.
And side effects are very minimal. And
Yeah.
I think a lot of people look at some of these stuff on Google and, a lot of the
Yes.
fear mongering because they read about
Yeah.
side effects, people having sexual dysfunction, things like that.
And of course, you have to be careful. For example, if a patient says, I am taking an antidepressant tablet,
Exactly.
so we don't give them finasteride, even not low dose.
Yep.
We don't recommend it.
What do you think about topical finasteride?
Topical finasteride, it was very popular like 5-6 years ago. And then the popularity comes a bit lower. People say it's not easy to use, it's like a gel. And I feel they change again to the tablet because it's easier to take it. But now I see again, it comes again more popular. I don't know, because maybe it's about adaptation of people. People start to adapt to the feeling of the finasteride because it's like a gel, and it's you have to massage it on the scalp, or is it easier to take a tablet? This is the decision of people. But if you have to take something, and if you get the side effect of oral finasteride, then you can use, of course, the topical finasteride. It works. It helps.
So Dr. Acar, what are your thoughts on oral minoxidil?
Oral minoxidil, I don't recommend it in our clinic too much because about the side effects.
Yes.
So still the topical one, Regaine or Minoxidil and other brands are more popular.
Okay. And do you stick with twice a day for minoxidil?
on the beginning, depends on the hair loss situation, once a day or twice a day.
Once
I
or twice a
decide
day.
with the patient.
Yeah, it really depends on a person-to-person basis.
Yeah.
Okay. Moving on, there's a lot of stigma, negative stigma, when it comes to hair transplantations in Turkey, especially because they utilize a lot of technicians.
Yeah.
Some people are a little bit hesitant because they want the doctors to focus more on the patient than the technician. So, what are your thoughts on that, and what can you say about for those who are worried about this type of issue that they are?
This is a very important point. This is not only for Turkey; it's also in many countries is like that, because hair transplantation becomes very popular, and many doctors who come to the field, many hospitals direct with his name, with a big hospital name or many other things, they want to benefit with that. So what we are doing is we are focused on hair transplantation very deeply, and I educate my staff myself, and we have a protocol, we have a system. And it is so, there is in some countries different rules which is not in the other country. And as we know, there is a term of senior nurses.
Okay.
And this is very important. It means the doctor cannot make everything himself. He need a staff, he need a medical staff with him together to make such as difficult, long time work to get to finish it, because the hair transplantation takes about 8 hours, sometimes up to 10 hours if you speak about 3,500 grafts. And if the doctor want to do this himself, the patient needs 5 days for that, because the doctor can do everything himself just in 1 day, about like 700 grafts if you want to do all steps. So that's why it's a teamwork. Doctor has to supervise, doctor has to make the planning, the hairline design, the hairline placing, which tools is better for him, which punch of size, which type of punch, what is the recipient site. It is a direct implantation, DHI Sapphire or pincet. If this, what size of this is important. Single grafts, multiple grafts, distribution are very important. If the doctor is really in the clinic and he make the planning, and if he have also senior nurses, I think there is nothing wrong.
All right. Okay. And I just want to emphasize,
the patient can feel safe because he have to know this system, this clinic, this doctor, these senior nurses, they do this every day, and they have very high experience with different type of skin, different type of skins, different type of follicles, different type of hair loss situations, how to manage a large field hair loss, how to manage young people, how to manage beard transplantation. So everything is about the experience, and if you make it with all together with a system, then it brings very good results.
Okay. Now, aside from hair transplantation, I know you spoke a little about beard hair transplants.
Yes.
Can you talk a little about beard? Because I know some people, they want to grow a full beard, or they want to fill in some of these sparse areas. So, how does Cosmetica actually conduct the beard hair transplants?
Beard transplantation comes very popular. I just want to explain something. Again, as a hairline, the beard line has also very important rules.
Okay.
First of all, on the beard part, we don't make like a straight line, which is looks unnatural. We have to make the distribution a bit higher in compare to the hairline. We make the irregularity more higher, more bigger, more wider. So in the end, if you let the beard grow, it looks 100% natural. The directions are more close to the skin, and the transplanted follicles should be mostly single grafts.
Single grafts, okay.
So that's very important. Even if you get a hair follicle with 3 grafts, you have to split it to single grafts and implant them very close, very flat, like 5 degree, maximum 10, 15 degree to the skin. And the line is very critical again. And here we put also like the soft single grafts, here the thicker single grafts. and then we get very nice looking, undetectable results.
A full thick beard. And also
Yes.
vice versa, from the beards to the hair.
Yes, it is
to the
also
scalp.
possible that we take beard hairs from the chin position, from the neck position to the needed area to fill the gaps to increase the density. But we don't use them to the front line or the frontal portion. If the patient needs more grafts to the crown, we use body hair, beard hair and chest hair. This helps for a fullness, for better density, better volume, and it is another donor area.
Right. I wouldn't be a good candidate because
Yes, I see that.
Okay.
But maybe in future,
Uh-huh.
once we see the hair loss is
Stabilized.
then we can maybe speak about a beard
About a beard?
transplantation, about a very soft beard transplantation.
Okay.
Who
yeah.
knows?
Yeah, always a possibility.
Yeah.
Yeah, okay. Now in front of you, you have the RoboPen. I know you've been speaking
Yes.
a lot about the RoboPen, and a lot of people are
Yes.
interested. Can you tell us a little about what the RoboPen is and what the functionalities?
Of course. So the RoboPen is a linear axis motion which mimics the hand of the human. As additional, it makes something better. So what is better with the RoboPen what the human hand cannot do? So we take so for example, this is the incision device what we're using, for example, Porticue or Sapphire handle. So we are making very small, very precise incisions, and we have to make it as parallel as possible to the neighbor incision to not make it damage under the scalp, because you can maybe see it's on the top on the scalp, everything looks parallel, but if you change it just like about 8 degree, just about 8 degree, and if you go 5 millimeter deep, you come too close together. It means damage the blood circulation, again, lower success rate. And in other hand, another person, assistant, sits close to you, and he have to count this motion.
Right.
You can see it's not low, it's quite high speed. So he can sometimes give wrong information to you, which is normal.
Right.
300, 400 plus, less, then you have to change your plan again. And the Newton, sometimes you are using this power, you want to change the position, my arm, my leg, everything is changed.
Right.
So it's difficult to get the same Newton. What does it mean? The tissue separation is not as the same quality, the depth of the blade doesn't go in the same point, and the implanter team says here is not as comfortable to implant as here, or here the incision quality is not the same as on this field, because the Newton is changing, and at the time you get tired, you get really tired after 1,000 incisions, 2,000 incisions, you feel that your hand gets tired and you have to press the instrument more to get more power. So the power, the linear axis, the Newton, all of these, and the counting what another person does, everything is transferred to the device. I just press to the button.
It counts
and
exactly.
you can see it counts. The power doesn't change. It's a constant power. The stroke is as you want. The depth, because of the linear axis motion, and the same Newton, the tissue separation will be the same.
Right. So everything's consistent and uniform.
Consistent, uniform. But in some part, for example, the frontal area here, it's much more sensitive than the front line. Then we have to change the power. It's very easy. We came here on the menu. We came from the medium skin to the thin skin. Sorry. So here it's medium. I come to the thin, and then I will work in the very sensitive part. It means lower Newton, less penetration force. So you are here very precise. And as we know, the crown is the most difficult part.
Right.
There are many reasons. One of the reasons is the used penetration force power. If you come here, you have to use again the thin incision mode. Then you are safe. It makes incisions, and because of this linear axis, it is less possible in compared to the manual to damage the neighbor incision. It's less possible because in hand we have something like curved motions.
Right.
If you look on the close, they are slightly curved from the side and from the front, because that's the hand anatomy. You cannot make it like that. It's not possible. But here I can do that.
Yeah, that's amazing, because this would be the first handheld automated incision device.
Yes, I'm proud of it. It is the first one. Really, it's the first one. We make it from A to Z new. It's not copied from something or from someone.
Right.
It is 100% a new idea. That's why it's patented also for myself. And we work with good engineer companies and software companies from Turkey, the software company, and all the stuff, the motors, the system is made in Germany. So I'm very proud of it, and I bring two big companies together. They believe in the project, and we get it.
Yeah, and it makes sense because we have the automated extraction devices. Why not have something for the incision?
Yes, this was my question. Right? We have the manual one, and then we get the automated extraction devices, and this improves the hair transplantation. It brings the hair transplantation in a different level. And I believe for the recipient side, the RoboPen will also bring the hair transplantation one step further.
And you've also been compiling some before and after results using the RoboPen.
Yes, we have the results. I'm very proud of them. To be honest, it is slightly better than what I think. Okay. What I expect, and I'm very happy for that. I think the mentality about the parallel incisions, about the Newton control, about precise Newton, about the depth control also you can here organize. The depth also, if you don't want to, if you are very sensitive part, you just want to go less, for example 1 millimeter less deep than the length of the blade, you can organize that. Wow. So it's have many functions, different skin types. For Afro-Americans, they have a spatial mode. For European Caucasians, they have another mode. It counts exactly. They have a different speed mode. You can start very slowly, and then you can make it higher speed. On the higher speed, the technology, the software is changed a bit to adapt for the speed, for the safety. And yeah, it is. It's incredible. It's nice. And after I use it, I asked to me how I did it before with manual. Really, I asked this question to me, to be honest. After I using this, I asked me, wow, how I did the manual one. It's so difficult. You can't go back. You cannot go back. You just want it. So eventually, the RoboPen is something your clinic is going to incorporate into hair transplantation. Yes, we are on the way to implement it for all the patients. And of course, if patients want to do the operation with RoboPen, they are welcome. Okay, that's amazing. And I look forward to sharing some of the before and after results. They are ready. I will give it them to you. Okay, incredible. Yeah. Okay. Now moving on, let's talk a little about Regenera Activa. Yes. I know you've been talking about a lot about this FDA-approved treatment. Yes. So what exactly is it, and why is there such a big hype about this treatment right now? Yes, the Regenera Activa, it's so we have different stem cell treatments. PRP, stem cell treatment from the blood, from the fat, we get stem cells. It's also rich on the stem cell. And there is a new system which focuses directly to the hair follicle. It takes the stem cell, the fat tissue, the surrounding tissue from the follicle, and it makes it ready to make an injection. So that's why there was many research on very important fields, and we see that Regenera Activa is effective, not lifelong, but it is effective from 1 year to 1.5 year.
Okay.
So you don't need to repeat it every month or every 6 months. 1.5 year is good enough. It helps to maintain at this long time. So that's why we will start to give the option to our patients if they want to have the hair transplantation combined with Regenera Activa, then they will get this in the clinic.
Okay.
The advantage is, first of all, we have existing hairs, right?
Right.
We make the implantation between the gaps, but he have to maintain his existing hair in other hand to have a full result. Regenera Activa will help for that. The other thing is, if the patient doesn't have enough donor area for make a full coverage, then we will focus on one part, and to the other part we will use the Regenera Activa. So it's for maintaining, it helps slightly to grow more hair. That's also a point of the system with the stem cell treatment and combining, or sometimes people are coming just before the whole hair loss comes too strong, just on the beginning of the hair loss. They come, they want to make this treatment, and then for 1.5 year we stay in contact, and if they need another one, then we repeat it. But the frequency, as you see, is not like 1 month or 3 months, it's just every 1.5 year.
Do you think it also helps with shock loss? Because you know, some people after hair transplant, some of the native areas,
it's possible. It's possible. It's possible. It can be used also on the donor area to do faster healing on the donor area. Sometimes people are just using it for faster healing.
Okay.
It is of course possible, but we want to use it for increase the volume, the density, to maintain the existing hairs. And if the donor area doesn't have enough graft number for full coverage, then we will support it with the regenerative medications.
Well, Dr. Acar, thank you so much for your time. It's been very educational. Thank you for all the information pertaining to hair transplants. And also thank you for the incredible work that you and your staff have done in helping people, men and women, who have been suffering from hair loss. I look forward to our next Q&A session. If you guys have any other questions, please make sure to leave them in the comment section below. And until then, I'll talk to you guys next time. Take care.